Okay, thanks, Carolyn. That's great. Great. So I'm going to get started. Jason, thanks so much for thanks so much for helping out. And so first of all, welcome everyone to our webinar today. It's meant to be pretty casual, so feel free to, if you do have any questions, feel free to plug it into the chat or unmute yourself when I'm demoing the website, and just let me know if you have any questions during the entire webinar. So just wanted to provide a quick introduction or even a refresher on those who are acquainted with our CAHSS website and tools. My name is Dr. Doris Leong. I'm the Interim Division Director with the Canadian Animal Health Surveillance System. So I just wanted to briefly acknowledge the land that I live and work on before I start my webinar. And so I just wanted to mention that I live and work and play on the beautiful and unsurrendered land of the Halkomelem people, and that's located in New Westminster, BC. I also wanted to acknowledge that June is the National Indigenous History Month. I wanted to mention that our organization CAHSS is committed to reconciliation and honoring all First Nations, Inuit, and Métis people. We're looking forward to we're actually looking forward to new collaborations with Indigenous communities on ways to advance animal health and ecosystem health in Canada. So here's a brief outline of the webinar. I'll just be quickly going over CAHSS and what we do, and then I'll pretty much dive into our CAHSS website. So that's pretty much, we call it our centralized information hub. We're going to go over our resource and tools, and then I'll kind of show everyone our surveillance network pages, as well as information products from each page. If we have time, I could even go into the CAHSS portal, so the back end, or the portal password protected end of the website. So you do have access to that if you are a CAHSS member. And then I'll quickly go over the social media accounts that we have with CAHSS, and then we should have enough time, probably 15 minutes for a Q&A. All right, so CAHSS, the Canadian Animal Health Surveillance System, is a division of Animal Health Canada. It was formerly known as National Farmed Animal Health and Welfare Council. CAHSS's work is to support effective, responsive, and integrated animal health surveillance in Canada. We have 4 key work areas, and that's the first one is to build people networks. Second one is to information and resource share. Third one is to build surveillance national capacity. And the fourth one is to create collaborative surveillance projects. And so CAHSS is actually a national surveillance system that is really built on the network of network structure. We've worked really hard to establish trust and rapport with public and private sectors from different groups that work to advance and improve animal health and surveillance in Canada. And so as you can see here, some of the images are from our surveillance, kind of representative of our surveillance network groups. We have 7 commodity groups within CAHSS, and that includes our aquatic, beef, companion animal, dairy, poultry, small ruminant, and equine surveillance networks. We also have 2 special topics networks, and that includes vector and vector-borne disease, as well as antimicrobial use and antimicrobial resistance. We also have a few different working groups, and that includes our horse census working group, our smallholder working group, and our newest one, which is our small ruminants alternatives to therapeutics working group. So each of these networks purposely brings stakeholders together. We meet every quarter online over MS Teams and Zoom to discuss animal health, identify surveillance priorities within each network, and plan surveillance activities across Canada. I just wanted to mention we also have around 600 members of CAHSS, they're all either English speaking or French speaking across Canada. And so onto our website, tools and resources. But before I go into that, does anyone have any questions so far? All right, that's great. I'm going to quickly kind of switch gears here and share the website. All right, you should be seeing the CAHSS website. Let me know if you don't see that. All right, so basically our CAHSS website is CAHSS.ca, so CAHSS.ca. Once you kind of plug that in, you could either stay on the English side, or you can hover over to the French toggle language and you could go to the French side here. So our website is fully bilingual. And so once you get here, this is kind of what we call our landing page. You're going to see quite a few things on our landing page. So you could either access our surveillance networks through these things called the content tile. So as you can see here, we have our 7 commodity groups and our 2 special topic groups here. So you could either go in here and you can access the network pages through this, or you can actually, if you go over here, you can actually just kind of access the specific network page you're looking for through this drop-down menu here. So the other thing on our landing page is we have a quick, like kind of a 1-minute introduction on what CAHSS is. And this is also on the French side as well in French. We have some of our tools here. So you can see here, we have our disease alerts. We have our key documents, which is within our resource library. We have the latest events as well. These are also you can access them within our different pages, but just kind of wanted to, we put them in our landing page so people can, excuse me, so kind of have like a one-stop shop if they do want to kind of access everything on the landing page. And then lastly, we have our achievement report, our annual achievement report. So this last one was from 2021 to 2022. We are currently working on the 2022 to 2023. And so once we get the newest one in, we're going to probably plug it into the last part of our landing page. Again, I don't know if anyone's joined a little bit late, but feel free, it's a pretty casual kind of webinar. So if you have any questions about how to use any tools or how to access our website, feel free to unmute yourself and just ask a question, or you could just plug it into the Q&A or the chat box. So if you have any questions or if you want to learn more about CAHSS, you can kind of hover over to our mission and vision. If you go into governance, you can find a little bit more information on our governance charter. If you want to learn more about our network of network structure, how our networks and steering committee function. So we have a PDF document here. We have our 5-year strategic plan for CAHSS in this content tile. If you want to learn a little bit more about Animal Health Canada, as well as how we're linked to the different divisions and projects within Animal Health Canada, you can see a few of the documents here. The other thing I want to mention, if you hover over to the About Us, is I think I've already mentioned a little bit about the annual report. This is sort of the where we keep all the other reports as well. So we basically have quarterly newsletters, and these newsletters are available again in English and French. We have updates from our different network groups. We have updates from our different regional partners who we work with closely, and that includes Ontario Animal Health Network, Western Canadian Animal Health Network, RESO in Quebec, and the Atlantic Canadian Animal Health Network as well. We also have some updates on the different collaborative surveillance projects that we do, so feel free to take a look at our networks here, our newsletters here. And then here again, I think I've already mentioned, but our annual reports for the year is just here, and then we're going to put in our most recent one here as well in the next few months. The other thing I want to mention in this About Us page in this dropdown is that we do have an event listing. So what we were trying to do is really create a centralized page where different stakeholders, whether you're a producer or a veterinarian or a veterinary student or an ag student. So any animal health or surveillance events, webinars, conferences, we're trying to put it all in here. And you can kind of see it goes from most recent to kind of something like, so kind of from the beginning, it's the most recent events. And if you click onto each link, basically it kind of gives you an idea of the conference organizer and author, location of the conference, start and end time, as well as the registration link. So that's the About Us dropdown. Does anyone have any questions so far? All right. Moving on to our CAHSS tools. So I'll start with the first one. This is our resource library. And so this is where we're housing all of our most recent, our journal articles, our infographics, our fact sheets, anything from our external surveillance partners, anything related to animal health and surveillance in Canada, we're housing the information here. So the nice thing about this resource library is you're able to actually filter, you're able to use different filters within this library. So you can actually filter by animal type, kind of just, excuse me, expand that so you can see here. And then I can kind of maybe do a few, maybe just click on a few as examples after. So you can filter by animal type, you can filter by disease agent. And then you could also filter by disease agent type. So whether it's a bacteria, virus, or fungus. You could filter by the type of organization that's producing the resource, as well as region in Canada, or whether it's outside of Canada, in the US or international, production system, media type. So whether, as I mentioned, if it's a journal article, a case study, some sort of newsletter, or an infographic, it's all, you could just kind of filter it here. How often the article or resource is published. And then also you could filter it certainly by just the date range as well. So basically, if I just go back to the animal type, I just wanted to filter maybe, let's say, bovine. So you're going to see all the resources. The most recent resources in the front, on the left-hand side. We're going to see all of the things that have been filtered under bovine. We're going to see here. And then you could just kind of you could just go into different pages. Another way to access these resources is to just export it into CSV. Then you're able to see what you filtered and then all the dates that the resources were created. And then another way to kind of show what kind of resources we have in our library is with our dashboard. So I'm going to just move this over. And so basically, you can actually, again, these are the filters that we've used, but we just wanted to visualize and kind of demonstrate the types of resources we have within this library. You can see here, we have a total of 258 resources so far. We have quite a few that are tagged with influenza, which is not a surprise. And then you can actually filter by organization. So the types of organizations that have that we've had resources tagged. CZ is one of the top organizations that we have resources from, followed by us, CAHSS, and then CWHC, OWIN, CFIA. So this is kind of a nice way to just kind of quickly see like, well, okay, well, what kind of resources are, coming out of Canada and which provinces and what kind of topics are of interest to animal health stakeholders right now. So it's kind of, in a way, it's kind of a very nice, this dashboard is a quick overview of what's in the dashboard. If you're, if you want to see actually what's the actual, if you want to like retrieve the actual resource, then you kind of use a resource filters here, and then you're able to grab the resource by clicking onto the content page. So for example, if I want to look at the CZ, so the Community for Emerging Zoonotic Disease Discipline specific report, click onto this content, excuse me, detailed page. You can see what it's tagged with. So it's tagged with bovine, tagged with BSE, FMD, and lumpy skin disease. And then we're seeing that CZ's producing these quarterly. It's a report. And then you just click on the link. It takes you either to a PowerPoint or a PDF or a different website. Any questions on the resource library so far? Okay, so moving on to Surveillance Initiatives Library. So this was created because basically we wanted to create an inventory of all the initiatives related to animal health surveillance in Canada. I think we're still missing quite a few. So we do encourage people like our CAHSS members or people or people like yourselves to take a look at our surveillance initiatives library, see what's missing. And you could certainly either email me and say, hey, well, actually the project I'm doing or the program I'm currently involved with is not here. And then we could either have you enter it in through our submission form right here, or you could just send me information and I could just plug it into our surveillance initiatives library. So again, it's quite similar with our tags. So we could actually look at it by animal type, disease agent type, organization or region, production system as well. Other things we can kind of filter through with this surveillance initiatives library is whether it's a disease investigation, a program or a project, the type of surveillance, and then also I think this one's a little bit different as well, the different topics that's part of the surveillance project. And so I think we do have a few we need to update. So feel free to, I do encourage everyone to look at this page and see if there's anything missing. And if there are, just let me know. And then here with our dashboard, again, it's quite similar to the resource library, but we're able to kind of just kind of very quickly see the types of surveillance initiatives that are currently available, that are currently housed in this CAHSS inventory. So again, you can see it by animal type. We could look at it by disease agent. So far we actually have 14 CWD surveillance programs listed in this initiative, followed by pseudorabies, E. coli, Campylobacter, influenza. We can look at different types of organizations conducting the surveillance programs. And then we can kind of see very quickly the type where it's located across Canada, and if there's any US initiatives that we should be aware of as well. All right. Any questions on surveillance initiatives library? All right. So I'm going to quickly go over to disease alerts. And so this page is essentially where we house all of our disease alerts. We're really aiming to receive information from our surveillance partners. And then once they're verified and validated, then we post them onto our CAHSS disease alerts tool. And then depending on the type of disease it is, we then push it out through to our listserv, to our network members. And so we've been doing this quite a bit with our equine diseases, especially if they're reportable. So if it's equine infectious anemia, if it's EIA, we end up, in addition to publishing the disease alerts onto this page, we end up sending an alert right as immediately as possible. We send an alert to our mailing list of around 90 people from our CAHSS Equine page, from our CAHSS Equine network. And then we do encourage them, for example, to, and I can show you in a bit, we encourage them to look at our equine dashboard that is made from the CFIA for more information. So let's see. Oh, thanks, Antoinette. That's great. So going back to disease alerts, so basically we're receiving these alerts from our network members. We're receiving them from different surveillance partners. Once we receive them and validate them, we put them into here. And again, it's in French as well as in English. And so basically, if you click onto the detailed page, you can see the alert, a very quick blurb of the disease, the case information. We usually have the date as date of confirmation. And then we have kind of information that could be interesting to our stakeholders, which is how the disease is classified federally, how it's classified by the province. So for Quebec, the animal type, the susceptible animal type, organization, and then also the event size and the clinical symptoms and the problems that the animal had with the disease. And then also we usually include a link if there was, so for this one with equine influenza, actually my PAC provided this information. We do have a link to EDCC, which provides more information on equine influenza. I have been in touch with Dr. Marin Rondeau, who is the provincial vet at MPAC, to see if there are any resources from MPAC that I could link to. So we do have quite a few actually equine disease alerts. And so the nice thing about each of our tool is you can actually export it to CSV. So maybe I'll just show you, hopefully I could share the screen. I'm sorry if you could hear in the background, my cat is trying to go outside. She would like to be an outdoor cat, but she is most certainly an indoor cat. So you might be hearing some howling. I apologize for that. So basically, you're able to export the disease alert into a CSV file. And so you can kind of see here, it goes by basically the most recent alert to the oldest alert. And you can see when the disease alert was created, the organization from which the disease alert was created from, and then also just all the information that was available in that detailed listing page is now in an Excel file, a CSV file. So if you do want to, further analyze this or kind of use it for your own reporting purposes, you certainly can. Any questions on the disease alerts? Eugene is asking, do we have any idea of the amount of fire and smoke injury to both domestic and wild animals? It seems that could be a big concern that we are faced with. Yeah, that's interesting. Thanks for that comment. We don't have that current information, but I am hoping we talk a little bit more about this at our CAHSS calls, like our CAHSS network calls. And so I should have mentioned this earlier. Like, I think what I'm trying to demonstrate today is, our website is considered a centralized information source. We have these tools, but really it's really important to know that this is an extension of our CAHSS surveillance network meetings. I think this is our meetings are really important for information resource sharing, coming, discussing new topics that come up. And I think this is certainly something that we do want to bring up with the wildfires currently within our equine and our different network groups. And so we do have a dairy network call this Friday. So I might see if we can bring this up and see if there's any conversations or anything anyone's finding. So thanks for bringing that up. That's definitely something that we would like to pay attention to. Okay, so I am going to go back to our website again. Does anyone have any other questions?
Doris, I have a quick question. I'm sort of following along on the website, and when I go to the disease alerts tool, the most recent posts I have on my end are like from 2022.
Okay.
So I'm just wondering, could that just because I don't have like maybe my membership hasn't been updated or something like that? Is there something I could contact to look into that?
Yeah, okay, so that's a good question. Are you in the are you in the portal side of CAHSS or are you in the public side?
I did actually log in.
Okay. Then if that's the case, then there's something going on that's glitchy with our website then. Because
Okay.
so basically, and that's something I should talk to you about with our website team, because essentially we're not trying to have like a barrier to accessing disease alerts. This is publicly available. So what you're seeing on disease alert page on the public side should reflect what is on the portal side. So I have a feeling there might be a small glitch on the portal side then. But if you're not seeing, if you can go back to the public side, and if you're not seeing 2023 disease alerts, then that's an issue that I have to deal with probably right
Okay,
away.
perfect.
Yeah. Okay.
I'll look into
Thanks.
that and I may shoot you an email or something if I
Yeah, that would be
do.
great. Okay,
Thanks so much.
thanks. Okay. So that's sort of our disease alerts. What we're trying to do is, in addition to asking our regional partners or surveillance partners to submit their alerts to us, whether by email or whether by the form. We're also trying to see, um, you know, if there's anything of interest that we should bring back up to our surveillance network. So I think one thing that came out a few months ago was where we were seeing some canine distemper cases in British Columbia. And then we brought that back to our companion animal network. And then I think Marine's on this call as well. And in discussing with the network as well as Marine and a few other experts, we realized that we were missing an information product, like some sort of fact sheet, an infographic related to canine distemper that would be helpful to pet owners. So we ended up actually making an infographic partnered with Owen, as well as got really good advice from a few different subject matter experts and got that pushed out. I would say last year we got that pushed out in French and English, and I could share that once we get into our different CAHSS network pages. Um, any other questions on disease alerts? Okay. So maybe I'll quickly go over our next one, which is our regulated disease table, which, oops, can you see that? I think okay, I'll do that again. My apologies. There, can you see this table?
Yeah.
Okay, great, thank you. So we're actually, I'm quite proud of this table. It took a while to build. The reason why is it's because it's kind of it's responsive on the website, and it kind of changes based on what you're plugging into these little text boxes here. So first of all, this is basically a regulated disease table. You could either, if you want to drill down on a specific animal, you certainly can by clicking on 2 different categories. Otherwise, you can basically just enter a disease name. So let's maybe, for example, let's do rabies. And so you can see here we have anything that picks up rabies. So we have these 3 rows of diseases. Let's look at rabies, the 3rd row. And so you can see here are basically means reportable. So federally, it's federally classified as a reportable disease. And then you can kind of see across the different provinces what the classification is. So for example, in BC it's reportable, in New Brunswick it's reportable, and you can kind of see it from there. The other way to use this table is basically if, let's say, I want to see all the reportable diseases from the CFIA, so you can just press type in R, and then you can kind of see here's our list of reportable diseases. And also let me know if it's small. I'm on my laptop right now, so if you're like, if this is too small, I could increase them. I could zoom into my monitor as well. So let's say there's it's reportable diseases for CFIA. I can now see, well, across the board for different provinces, what their classification is as well. So this this is quite interesting. It's kind of a one-stop shop of getting information. We've grabbed all this information from our different provinces. There's a link here. Maybe I'll just click onto a new window here. So you should be able to see this. Can you, just to confirm, can you see a different window that says regulated disease resources? Or am I still on the first the table page?
No,
We
you're
can
good.
No,
see,
it's good.
Okay. Thanks. I'm used to we're using a lot more MS Teams now, so when we do the screen share, it works a little bit differently. So basically, if you're like, well, I actually want to know specifically with the province of BC, their classifications for different diseases, then you could actually click onto the link, and there's information there. Otherwise, as we were building this table, we did consult with a lot of our provincial stakeholders. You might be seeing some provinces that are missing here. It's because we had basically, as we were building this, we didn't hear back from them, but we are open to, now that we have this table published, we are open to changes or additions. So I think recently we had Yukon add in a few more edits to this page. If you're seeing something that's obviously classified an error, just shoot me an email after the presentation, and we can certainly make some changes. It's not too hard now that the table is built. It's just kind of going into the back end, clicking on some windows and changing the classification. I have had some people ask about adding different diseases as well. So that's definitely an option for this table. The nice thing is it's kind of an evergreen document. It did take a long time to build, but now that we have it built, the technology is in place, we can actually add additional diseases and their classifications if needed. I see a question. Are you able to know when the disease status changed eventually?
Doris, maybe I can give more details about my questions. Just to have, are you able to track the historical variation of the disease status in this
Okay.
in this table?
No, what we've been trying to do is we're trying to have the most recent and updated version, just to make it a bit more streamlined for users. But what we were trying to do is encourage people to go on to the resources from the different provincial governments and CFIA if they did want more information. Do you think, Antoinette, just kind of following up with your question, do you think that's something to track historical statuses? Do you think that's something that stakeholders would like to have on this table, or do you think having it available as an external resource would be good enough?
Maybe not directly on the website, but an easy link to have this information would be, I think, very valuable to better interpret the surveillance data related to the disease.
Okay. Okay, good to know. Thanks. That's great. So I'll make note of that. And this is why it's great to have these webinars to connect with our CAHSS members and non-members, just to see, what would make our resources a little bit more practical or just more relevant to your day-to-day work. So the other thing you could do with this table, so you could just clear, you could either delete or you could clear your kind of what you've entered in. You could actually just go by animal type, as I mentioned earlier. So let's pretend, let's say I'm interested in poultry diseases. And then here, basically, that's already changed. It's a responsive table. So you can now see that this is all these are all the poultry diseases we have. And then let's pretend I want to see all the notifiable diseases in BC. And you can see here, now we have, so this has changed. So now we have all the diseases that are notifiable in BC, what they're classified as federally, and then if you want to compare with different provinces across Canada, how they compare with this disease of interest. Any questions on the table so far? Okay, so I am going to go to our podcast page. I think some of you who follow our social media, so our CAHSS Twitter or our LinkedIn, you might be aware of our CAHSS podcast page. It's called Animal Health Insights. We launched it around 2 years ago. And so we are fortunate enough to have Dr. Kate Todd. She's a veterinarian out in Ontario. So she's our main podcast host. She also helps edit the podcast and make it all nice and professional. And then we have it published onto our CAHSS website. And so our topics range from One Health to AMR, AMU. We have quite a few different types of topics, and just really it's to engage with people that work with animals and are either they're in the animal health or One Health sector in Canada. And so, as I mentioned, we have everything from our earlier episodes. We had a One Health episode with Dr. Jane Parmley. We had a biosecurity in beef cattle herd in Western Canada. We had a tick episode that was released during the spring summer months. We had an episode with talking about Salmonella Dublin and the challenges with S. Dublin and the diagnostics related to S. Dublin. Our most recent episode we usually put on the top. We call this our 50/50 banner or 50/50 Navy banner. And so our most recent episode, episode 23, is on managing mutual microbes, One Health farm animals, and AMR, so antimicrobial resistance, with Dr. Mohamed Rouma. This episode is also in French. We do have quite a few French episodes. We're endeavoring to have more. So we're hoping to have kind of a 50/50 split between English and French. So far, I would say we have 30% French episodes to our English episodes. So we're hoping in the next year or so that we could really have a few more French episodes with our website, our podcast series. What we've also done as well with our podcasts is that we have been sharing we call them our podcast pearls. So we've been sharing kind of one-pager infographics that kind of include just a brief summary of the podcast episode in case people want to share with their coworkers or fellow students. And just it's a way to help us kind of basically highlight our podcast episode that Kate takes quite a few hours. It's very it's a lot of hard work to interview our guests, and just wanted to really highlight the episode. So basically we have these kind of we call them the CAHSS podcast pearls, one pager infographics, and I could share that with you after I talk about I could share that with you in a sec. And this is also basically an opportunity for me to just invite you, if you have any interesting topics, if you're like thinking, well, I actually have an interesting research project or a program, and if it's in with Animal Health Insights and I don't see that topic presented yet, feel free to message me and I could see if we could get you to meet with Kate and produce an episode, whether in French or English. If you keep scrolling down, We do have episodes from our regional partners, and that includes the Western Canadian Animal Health Network as well as Ontario Animal Health Network. You can see here, I only do have 4 episodes for each. I do have to update them. I think eventually we're going to break them up and put them into another page for podcasts with our partners, just because we don't want to have this kind of endless scroll. So that's something in the making. I'm hoping to get that done in the next month or so. Okay, I'm going to quickly go to our frameworks and snapshots. So this is where we're housing our different kind of frameworks as well as infographics that have been created by CAHSS, along with our partners as well as our CAHSS network groups. And so we have a few that have been we made in the last few years. And so one includes the first one here on the left is basically a quick across Canada surveillance snapshot of our different AMU, AMR surveillance programs within Canada. And so this is just, you can kind of see those thumbnails here, but if you do click onto the link to PDF, you can actually get the full high resolution version. And so with this infographic, we partnered up with our AMU, AMR network, as well as a few of our subject matter experts from the Public Health Agency of Canada to get this infographic made. This other one is our cross-Canada surveillance snapshot of the different disease investigation units within Canada. This one is, we do need to update this one to include the websites, like so the hyperlinks of each of the DIUs. So it is still a helpful tool to use, but I do think in the next iteration, we're going to include some hyperlinks so people can just click on it and then get acquainted with the different DIUs across Canada. I'm going to just see, I think there's a okay, so Marianne, podcast, such a great idea. Can we sign up for it? Yes. So I was going to mention that after, but basically, if you go into cahss.podbean.com, that's actually our official, this is our official CAHSS website. You can actually subscribe and you can listen to it on your Podbean, like your podcast app of choice. So if you sign in and subscribe, you can actually just kind of be alerted basically when a new episode pops up. Another way of doing it is also following us on our social media. So anytime a new episode pops up, we do share it on our Twitter as well as our LinkedIn page. Okay. Am I back to my framework page? Just wanted to check. Great. All right. So a few other frameworks is something that we created a few years ago is our AMU reporting backgrounder. And so, feel free to look at this. We're hoping to get this used by producers and some herd veterinarians to see if it works. It's basically just kind of a nice and easy way to report antimicrobial use depending on the production animal type. And so we're hoping to trial this out within our AMU AMR network, and also just wanted to hear some feedback from producers as well as veterinarians as to see like if it's easy to use or if there's any feedback and any changes that we need to make with this report, with this backgrounder. The other one is our case definition framework. And so this was created as a collaborative project with CAHSS and the Veterinary Surveillance Epi Network. And so this is just a report on the importance of case definition, why we need it for surveillance. And we do have this available in French as well. So I encourage you to take a read and share within your own networks if you find that it's important. So that's our framework page. We also have been, in addition to creating our own information products and resources, we've also been able to house external dashboards from different partners. And so this one is the SARS-CoV-2 dashboard, and this was created with CFIA and ECC and a few other One Health partners. I think the last data set was from, the data point was from 2022 of winter. And so basically you can kind of see basically of SARS-CoV-2 confirmed cases, what types of animals, and in which province. And so you can kind of get the information here. It's quite a nice interactive dashboard. You can use the slider to kind of go by date period. You can click on animal type. And so you can kind of see here, if you click on, let's say, just wildlife, you can see all of the animals that have been testing positive for SARS-CoV-2. And so this was nice because we were able to help CFIA and One Health Partners house this in our website just because it was a little bit easier to make any edits. We're able to go into the back end of our website a lot quicker and just provide this information and it's just a little bit quicker. So we're able to do this, and we were able to promote it on our social media pages on Twitter and LinkedIn. The other thing is I'm going to move on to the CAHSS network groups. Does anyone have any questions on the CAHSS tool so far? I think we have 15 more minutes. Okay, so I will move on to our CAHSS network pages. So as I mentioned, we do have 7 commodity groups and 2 special topic groups. Each network group has their own specific page. And so every group essentially, I'm going to just scroll down here. Every group has, we call these content tiles. We have these kind of consistent content tiles. Every network group has this. So this one is our resource library. And so the nice thing is that what you're going to see when you land on, for example, this aquatic page is everything that's tagged with fish or crustacean. So you're not going to see, for example, you're not going to see anything tagged with bovine or anything tagged with cat or dog. You're only going to see resources specific to the aquatic species here. But if you're like, well, actually, I want to see other things, I want to see other animal species, you can just go back into the resource library and then filter accordingly. But the nice thing is that we have our resource library, kind of that nice tagged with just aquatic species tagged here. We have aquatic resources, so any external resources and web pages are here. And then we also have our podcast page. So just what I mentioned earlier, just our Animal Health Insights podcast series. You can just visit the podcast page by clicking this link here. The nice thing as well is, in addition to those kind of consistent content tiles, we also have things that are specific to the network page, whether they're things that we worked on as a network or whether they are information products created by CAHSS based on identified priorities from the network. So within the aquatic page, we have our fish health tracker tool, and this was created 2 years ago in collaboration with CFIA and CWHC as well as CAHSS. And this is a nice little app that we've created that helps report abnormal and normal fish observations across Canada. And so we've had around close to 3 dozen submissions so far, and we're still learning quite a bit on how to engage with anglers and people outside to continue to contribute to a community science program such as this one. I'll quickly kind of go over each of these network pages. So as I mentioned, within each of our network pages, we have these consistent content tiles. You wouldn't have seen this within the aquatic page because we're actually currently building a surveillance stakeholder map. So this is actually quite a nice little tool to have. We have it now for all of our networks. Aquatic, we're currently just making some final changes to some of the bullet points within the surveillance map, but we will have that soon. So I'm just going to click on this page and you should be able to see, just let me know if you can't see this page. So essentially we have our surveillance stakeholder map, and basically we're just really showing the different connections of data providers and data users of, for example, beef health in Canada, beef health and surveillance in Canada. And then if I just zoom in here, you can kind of see how we just have different, private and public connections. We have our regional and national surveillance partners here, providing information, as well as just kind of building connections within our networks to advance beef health in Canada. We have partnerships with the veterinary associations and veterinary community. And then within industry, the beef industry, we have different organizations that participate in our CAHSS beef network calls, as well as partner closely with us to provide information during our network calls. So essentially, all of our network groups have these stakeholder maps. They look a little bit different across different networks. I could even show maybe quickly our small ruminant network surveillance map, which was one of our newer ones that we created. And so you can kind of see here, it looks a little bit different, but essentially the connections are quite similar. We have our different surveillance network groups, which includes CAHSS, includes Community for Emerging Zoonotic Diseases, Ontario Animal Health Network, Western Canadian Animal Health Network. We also actually have some connections with the government of Alaska and other different types of groups in the United States. But you can kind of see here, really there's just, these partnerships with private and public sectors that really provide really important information on animal health related to small ruminants in Canada. So just I know we have 10 minutes here, so I'll just be a little bit quicker. So you can kind of see again, like our different network groups. I wanted to share our smallholder network page. Actually, there's quite a bit of information. We built this one quite a bit. So we have a smallholder working group. It's not a surveillance network, but it is a working group. It's a quite a bit of a smaller group where we're focused on looking at increasing communication and education for smallholders and for small flock owners, as well as small lot pig producers. And we're also looking at ways to engage veterinarians that normally don't practice in small flock. We're looking at ways to encourage them to you just get them more excited and more equipped in handling small flock cases. And so we created this page a year ago. We actually have quite a bit of information housed here. So we a year ago we had an update on HiPath AI and small flock poultry. So it's quite nice because we were able to get some subject matter experts across Canada provide this update. We were partnered with WeCan for this webinar. We also had a small flock poultry course that was 6 weeks in duration with course instructors Dr. Gigi Lin as well as Dr. Vicky Bose. You can't see that here because it's on the portal side of the website. So there are quite a few different resources that you might be able to see if you log into our CAHSS portal website, which I can talk to in the next few minutes. But I really do like our smallholder page because there's a lot of really good information. It's a nice kind of one-stop shop for smallholder information. So we have our small flock poultry. We call this a content tile. We have a lot of different recommendations from our different regional partners. You can see there's different things such as like a buying and selling guide, some recommendations on biosecurity, recommendations on specific diseases, including ILT and MG. For our small pig producers, we have different provinces creating different small production manuals. We have different projects related to small lot pigs. And then we have just kind of a list of diagnostic labs as well in case we have, veterinarians practicing and, working with smallholders and they're not entirely sure where to submit their samples. We do have a list of the diagnostic labs across Canada that accept samples. And so that's sort of, our network pages are quite different depending on the priorities of each network. There is, as I mentioned, there's some consistency with kind of those tools that we have within the CAHSS website, but each page within our network is quite different. So maybe I'll spend a few more minutes talking about our equine page, and then I'll go over our social media. So our equine page is actually one of our most landed on pages on our CAHSS website year after year, which is great. We have a link to the equine disease dashboard, and this was created from CFIA. And so maybe I'll just click on that right now. you should be able to see, basically, you could look at different types of equine diseases, or if you wanted to look specifically at equine infectious anemia. It's a great dashboard that houses a lot of really good information. So if I wanted to, for example, look at EIA cases for this year, we're seeing only one case, and that was in Alberta in February. We have information here. And so basically the CFIA staff, when EIA cases are confirmed, they update this dashboard. They then send CAHSS a quick message. CAHSS then updates our disease alert and also sends a quick message to our equine page, our equine network group. And so it is quite connected, where we're encouraging our network members to look at the dashboard. We're encouraging our network members to share the information to people in their networks as well. We also share our disease alerts on our Twitter. So we try to have as much as near real-time reporting as possible. And so that's our equine page. We also have some infographics we created. And so that includes, we created a kind of a 3-part series of, this is really targeted for horse owners, whether they need to use antibiotics for things like minor wounds or snotty runny noses. It's just kind of like specific scenarios where you might not necessarily need antibiotics. And then just kind of a nice call to action to reach out to your veterinarian if you have any questions. The other infographic we've created was just, we've seen so many EIA cases pop up, just something to complement that CFIA dashboard is this nice EIA infographic that we've created. And we've had a few subject matter experts from our equine network provide some insight on this infographic. And so really this is for our horse owners as well as equine veterinarians to share with people in their network. I'm going to just I know I only have 5 more minutes. Maybe I'll just quickly go over our social media and then maybe I'll quickly go over the portal side. But does anyone have any questions so far? Okay. So I just wanted to mention, so we do have a few different social media outlets. We have a Twitter where we do, it's kind of an extension of our centralized, our CAHSS website, but anytime there's any events like today's event, or if we have disease alerts, we try to post some onto our Twitter as well as our LinkedIn page. And so we do post in French and English. And we're trying to also basically share resources or important articles or any resource of interest from our regional or our national surveillance partners. And it's also been a really good way to network with people that aren't currently within our CAHSS network. So I think we were able to, I was able to meet a few people that should be in CAHSS networks and then actually ended up inviting them, and they're going to speak at a few of our future calls on the interesting research that they do. So I do think in the next few months, I would like to increase some of our engagement to more like of our ag students as well as our One Health partners. And I do think Twitter and Facebook and LinkedIn could be quite good avenues for doing that. The other thing is our LinkedIn page. And so again, our social media, we're using a few different channels just to engage with different people. I find that people on LinkedIn are a little bit different than our stakeholders or people that are on our Twitter or Facebook. And so we try to post information on any interesting news, any webinars or any events. I try to post it on our LinkedIn as well as our Facebook and Twitter as well. I think maybe I'll spend a little bit of time just to go over the portal side of the website, if that's okay. So just wanted to check, can you guys see my CAHSS page again?
Yes, we can.
Okay, great, thanks. So basically, if you're not already a member, you can click on the Join Us button. That takes you to the membership page. You can provide us with your name, your email. This actually really helps us understand who you are, your areas of expertise, and your organization. If your organization is not in this drop-down menu, feel free to just use that free text. And then the other thing is we do have members that just want to receive disease alerts, but not the meeting invitations. If you do want to join our CAHSS meeting invites, if you do want to join our quarterly meetings, feel free to check this off. And then what happens is once you're approved for being a member, I then forward the invitations to you guys. So let's, once you are a CAHSS member, you're going to log into the portal side. The thing that is different is within the network pages, they look a little bit different. So you can see here, basically we changed our, we call this our 50-50 page. And so we've changed this to a kind of a navy color. So we just kind of know, you kind of quickly know, well, I'm in the portal side of the page. If you want to go back to the public side, you just have to log out and go to the public side. The nice thing about the portal side is we have all of our records of discussion. So our meeting minutes from our network calls on our portal side. We have all the other information. So as I mentioned, those little content tiles we still have within the portal side. So you can kind of see the different records of discussion. If you missed a meeting and you just want to be caught up, you can just see the records of discussion here. We do have some resources that are available to members that aren't in the public side. So for example, this bulk milk tank testing for pathogens and antimicrobial report is here. This is not on the public side of the CAHSS website. There is also the federally inspected slaughter dashboard, which is created by CFIA. So that's another nice little resource to have as a CAHSS member. The other thing I just wanted to mention is once you are on our CAHSS website, I do encourage everyone to update their profile if they didn't register to be a member recently, just so we kind of know if things have changed with the organization or your areas of expertise. If you want to be connected to people within your network group, you can actually, again, filter by your network. So let's say I want to get acquainted to people in the beef network. And now we have everyone's profile here and their email address. You also are able to get that in a listserv, but this is a nice way to just kind of see, well, who's who in the beef network. And the other thing you could do is export as a CSV file as well, if that's if you're like me and prefer using a spreadsheet to look at a lot of information. So I am going to stop sharing for now. I wanted to see if anyone had any questions. Was there, I just wanted to see, I know there's quite a few people that are CAHSS members. Were there anything specific with each of the tools that you wanted me to go over a little bit more, or was anything confusing?
Doris, I had just one question. Under your CAHSS networks, do you have one for servants?
No, that's a good question. We're hoping to, so I think I mentioned this at our last Small Ruminants meeting, Bob. Basically, we had finished our project as of March of this year. We had just applied for new funding through Sustainable CAP. And I think once we get that new 5-year funding, my hopes is that we can create a wildlife domestic animal interface network group, because there have been a lot of discussions of the importance of having a national group that can talk about wildlife diseases, and especially those that have a domestic animal interface with it. So to answer your question, not yet. Hopefully in the next few months we can get that established. And then once we get that established, then we'll have a website and people could go there for information. And then we're hoping, I think I might not have mentioned it, but I'm hoping to have all of our surveillance network priorities housed within each group. So basically if you're looking at the aquatic group, you can just see, well, okay, these are the lists of priorities that the group's identified. And then people can kind of like get more information on the group, or just see if they're interested in joining the group after reviewing all that information. Oh, thanks, Antoinette. That's great. Any other questions? I know I kind of sped through our website. All right. I just wanted to mention, I know a few of you might have registered for the next session. I am going to just say, like, the sessions are quite similar, but I mean, I could always spend a little bit more time if you have any questions after today's presentation to kind of go over a few specific tools. So I would say, like, if you've already been to this one, you don't necessarily have to go to the next one. Just wanted to mention that so you could save an hour of your day for July and August. Okay, thanks, Maureen. Great. Thanks, Marianne. Any other questions? All right, I guess we'll just finish off then. And if you do have any questions, feel free to email me. I'll just put it in the chat right now. And then especially if you're in the portal side of our website and you're seeing something that's a little bit glitchy, then feel free to email me and I could get that sorted out. Thank you. Bye.